Hello and welcome to another episode of the TheSynapse eLearning series. With us today we have Dr. Joseph Spiteri, consultant psychiatrist, who will be speaking to us about burnout, especially in medical professionals. Dr. Spiteri, thank you for being with us here today. I look forward to having a productive interview. And on to our first question, how would you define burnout?
Right. First of all, I would like to thank you for inviting me to come along here. It is an interesting subject. That's what I'm going to talk about, is burnout. But before embarking on this topic, I think I would like to mention something a bit different in relation to the concept, and that is satisfaction. What is life satisfaction? And one can compare life satisfaction as the inverse of burnout. So if in life we have what we would like to have, our goals, and they are similar to what we are having in life, then we would say that we're satisfied with our lives. On the other hand, if what we expect in our goals in life are not met, then what happens is that we are not satisfied in our lives. Now, burnout can be compared to this situation. Medical burnout is in fact a rather common phenomenon. It occurs in about 33% of all the different specialties in the medical profession, which incidentally is quite high and which probably has a micro environment and a macro environment. That means that it depends on situations that are both personal and also in the environment on a rather bigger scale. That means who we're employed with. That can assume both in private practice and also in the NHS employment system. Now, we'll talk about what are the core symptoms of burnout. And interestingly enough, that helps us to identify the psychiatric components related to the way we think. The way we think, or put it more scientifically, the cognitions in burnout become very evident. And one of our main features can be identified is that we can think of both physical and psychological components of burnout. In terms of physical features of burnout, we talk about exhaustion. After a day's work, for example, a young casualty officer would feel tired, not at the end of the day, but also during the process of doing his work. And that's because there's too much vigilance and attention going by not to make any mistakes. So what happens here is that the physical aspect of burnout causes later on different ways of thinking. And the thinking process is where I'm concerned with most. Incidentally, we all have thoughts that have some of the symptomatology of burnout. And these include, for example, having doubt about our clinical diagnosis, having doubt about how we managed cases. We also tend to have features where we behave in a cynical way. Again, that is one of the main features of burnout. And people actually become very irritable and feel guilty about their thought process. In particular, that thought process involves this negative thinking and creating a feature of being guilty. So, we can think of burnout in 3 stages. I've mentioned before the issue related to the physical and the emotional aspect. I think, which I need just to mention for the sake of completeness, there is also a spiritual component to the features of burnout, but I won't dwell on that at length. From the emotional point of view and the physical point of view, we tend to become burnout when not we've been working for a long time at the post, but how we perceive what is going on around us. Here, the microenvironment is important, and the macroenvironment plays an important part. That means how we're treated and how we treat others. How we're treated by higher authorities, and as you know, in Malta we are undergoing a lot of changes, which is causing a lot of distress to the medical profession, a sense of feeling unsure about what's going to happen, a sense of, are we in the right direction? Are we doing the things as we're supposed to be doing? On the microenvironment, I think I need to point out that situations like family problems can also contribute to the features of burnout. Now, if we're talking about the phases of burnout, I think it's clear to say that we can think of 3 levels of burnout. And our progress in, just remember that I've said that 1/3 of doctors have burnout at a point in time. So that means that each one of us has got a significant chance at some point in our lives, so that if we're talking of a medical firm, for example, or a general practice of 3 general practitioners, we're talking that one of the members of the practice will actually have features of burnout. That is pretty high. Now, in the process of the phases of burnout, one can see that there is a safe zone, an evident zone of burnout, and the 3rd phase is actually a phase where there is a dangerous zone.
And in fact, I wanted to point this out, whether you can guide us. I understand that much of our audience has a medical background.
That's right.
So they may be wary in doing a self-diagnosis.
That's right.
There are some red flags which one should be cautious of.
That's right. So I've mentioned the core 3 symptoms in relation to burnout, particularly the way we think. And one big red flag would be the fact that we start doubting our decisions. And in fact, that is a feature of doubt, which is the backbone of early burnout. So creating all these anxiety symptoms will be a red flag towards saying, hey, where should we do and what should we do to prevent this burnout? So coming back to the levels, I think we will always experience days where there is a small element of doubt, light element of cynical thoughts, but sometimes we'll start off seeing that you go to work and you find yourself that you're already tired by the time you're starting. And that could be because of heavy traffic and gives you a bad start to the day. Could be problems at home and starting the day's work in a bad state. And that happens occasionally. So that's the safe zone. But if we go into the middle zone, that is of burnout, then these features will be present there on a daily basis. Not only do they affect us during the time of work, but they will also affect us during the time we're off work. Now, the 3rd stage, I'll mention that for the sake of completeness, happens when such thought process is so intensive that that person starts to consider, why should we be in this field? Why should we work in the medical field? And we start thinking of doing other things. We start thinking of maybe retiring. We start thinking of maybe, we could have done other work. And that is the danger zone.
So you've went through an elaborate phase of telling us about how we classify burnout according to severity.
Yes.
Now, I imagine that some of our audience may be thinking that, listen, this reflects my thought pattern right now.
That's right.
So what advice can you give them with regards to their management?
That's right. And I think we can think of managing non-pharmacological ways of managing burnout is simply by the what we call 3 R's. And that is resist, restore, and reduce. I've actually recently studied a course in business management, and these 3 features appear to be quite significant in management. And what are we talking about here is simply managing our time during the work in such a way that in the first place we resist as much as possible our process of putting our situation, of positioning our situation into a place where we find it very difficult to cope with our medical practice. The second phase of treatment, or at least instead of phase, I would say the second type of treatment, is to restore the energy that you would have lost while work. While most of us do our work sitting down, I think that also creates an element that due to the lack of energy and exercise, it will also give us a feeling of tiredness. And restoring that energy will be by having a shorter guide of working hours. As you know, for example, in the EU, we have been stopped from working long hours. I remember myself in the student days in England where we used to work a whole week on call. But after some years, they told us, look, we can't do that. It came down to on-call over the weekend, and nowadays it's actually just over a day. And it's also very clear that we're not supposed to do 2 on-calls after each other. And that's the reason for that is avoiding burnout. Unfortunately, it is not always respected, and it's a pity that we do not see that that is detrimental to our well-being. Reducing the exposure to situations where burnout can be caused is also essential. But we have to also be productive. And productive, we mean that we need our lives in our control, rather than in the control of the schedule of medical care. In our controls, we have time where to spend, which would be quality time where we don't think about medical practice, time where we can enjoy our family, and time where we can have that quality of life that gives us life satisfaction. So I'll try to conclude my little talk about burnout in the same way as I've started it. That life satisfaction is an important concept, and quality of life is probably one of the major features that gives us a successful way of living.
And only just one final comment.
Yes.
If I am a medical professional, I work in the National Healthcare Service here in Malta, and I wish to find more help. Are there any support structures which exist today in order to help me combat burnout?
Yes, I'm afraid I've got to answer you in the negative, because the system, while if we take the UK example, it is clear that the Medical Council has a support group for sick doctors, particularly at the end stage of burnout. Then there are other issues, which obviously due to restriction of time I haven't mentioned, but the question of alcohol-related problems, drug misuse. What I mean by drug misuse is actually drugs that are available in the medical hospital rather than illicit substances. And these sections in the Medical Council actually help these people that have experience. But above all, I think it's essential that in any system, it's the responsibility of the more senior staff to make sure that the younger and other staff are not exposed to unnecessarily stress that can cause burnout. And it is the responsibility which they should shoulder, especially when you see a high volume of turnover of doctors within a specialty. Why does that happen? And that's because our system has as yet is not coping with helping ourselves in the first place. I think charity begins at home.
True. Thank you, Dr. Spiteri, for your time. We hope that your invaluable advice will be taken in our stride, both to help ourselves and to help our colleagues who may be passing through such a difficult time. I also invite you, our audience, to share this video with your professional colleagues and to stay tuned for more updates on the TheSynapse. Thank you.
Thank you very much.